Hereditary hemochromatosis is an autosomal recessive inherited disorder involving the metabolism of iron. Patients who suffer from hemochromatosis experience accumulation and eventual overload of iron, resulting in excess iron deposition in the liver, pancreas, heart, joints, and endocrine glands. This deposition of excess iron eventually may lead to tissue damage that may progress into a variety of disease conditions, such as diabetes, increased skin pigmentation, heart failure, and arthropathy. Hereditary hemochromatosis is clinically recognized as twice as common in males and is especially prevalent in Caucasian populations.
If you're middle-aged and symptomatic organ involvement develops,
nonspecific signs and symptoms, including unexplained fatigue and joint and abdominal pain,
then you have the potential to be afflicted by late-onset hereditary hemochromatosis.
Age of onset is delayed in females, which may be attributed to blood loss via menstruation. Because it is a progressive disease, and because there are a multitude of other forms of iron-loading diseases out there, multiple biomarkers are needed to be detected in order to be certain that someone is afflicted with hereditary hemochromatosis.
All three biomarkers are retrievable from the same blood sample,
and the elevated presence of all three in conjunction with elevated serum iron levels is highly indicative of hereditary hemochromatosis. In order to detect elevated serum levels of HLA-A3, HLA-B14, and transferrin, we will utilize a single molecule, or simoa assay. Simoa is advantageous because it allows you to detect single protein molecules present in extremely low concentrations. First, an enzyme-labeled sandwich antibody complex is formed on a microscopic bead. A capture antibody specific for the protein of interest is attached to the beads. Then the blood sample is added to the solution containing the beads, and the antibodies on the beads capture the protein of interest. Following that, a detection antibody tagged with a small protein capable of binding a color-changing enzyme is added to the solution. It sticks to the protein of interest, sandwiching it. The enzyme is then added and captured by the detection antibody, whereupon a chemical solution is added. The enzyme causes the chemical solution to fluoresce, which is digitally detectable. The beads are then concentrated using magnets, washed, and loaded into an array full of wells with volumes of about 50 femtoliters. The array is then sealed to trap a single bead in each chamber, and its fluorescence is analyzed. This assay will be capable of comparing test sample protein concentrations to those of control sample concentrations and determining if they are greater in the test sample at a statistically significant level. It is assured that the assay will be able to do that because of the array's ability to isolate single beads and the device's ability to detect those beads. Furthermore, the ratio of protein molecules to beads will be manipulated to be less than 1:1, resulting in the percentage of beads holding a labeled complex following a Poisson distribution, which statistically ensures that there will be just one complex on each bead. That is important because of the concentration calculation, which is as simple as finding the ratio of labeled beads to the total number of beads on the array.
So, in summary, speak with your doctor today about conducting our simoa assay if you fear you or a loved one may suffer from late-onset hereditary hemochromatosis.